we're going to have to try to make up for those past mistakes, even though we didn't make them, by communicating with our Black population, with our Hispanic population, with folks who are hesitant about the vaccine.
We're doing this not just for ourselves. Anybody who takes that vaccine, we're doing it for everybody around us.
Well, from the president of UMBC, who took part in a vaccine trial, a doctor urging her patients to get the shot, an historian explaining why there is such distrust in communities of color, and a pastor trying to reach his congregation, how they are tackling vaccine hesitancy head on. Hello, everyone. I'm Jason Newton. Welcome to 11 TV Hill. This week, we spoke to 4 community leaders about why they are getting the vaccine and why they believe you should too. We spoke first with Dr. Freeman Hrabowski. And joining me now is Dr. Freeman Hrabowski from UMBC, the president there. Thank you for your time, sir.
Thank you very much.
Let's just jump right in with the vaccine. You and your wife jumped in on the trial when you had the opportunity, and I heard the press conference, and I think what you said was poignant, that this wasn't just for you. This is for the people around you. Can you walk me through that a little bit?
Sure. I think this is a time when we have to think about what the word community means, the idea that we're not on this earth just for ourselves, that we are here because of our relationships and what we can do to help other people. And my graduate, you've heard me say before, Dr. Kizzmekia Corbett, one of the lead scientists in producing this vaccine, and she's been talking about the need to have people of all races involved in the studies. And so my wife Jackie and I decided to get involved so we could show people we believe in the science, and I believe in my graduate. And the fact is that this gives us a chance to help other people, not only people in our homes, but and not only our grandparents and our parents and our children, but other people. Because when people see us taking this vaccine and doing okay, it says to them, we must do this also.
Tell me about your mindset when you talk about people seeing you and discovering it's okay, because certainly there's anxiety in the community with a lot of folks saying, I don't know, too fast, or I don't know enough of what's in this vaccine. For you, when the moment came, what was your mindset?
There were 2 or 3 things I was thinking about. Number one, that we have to be able to tell people why this period is different from years ago when we did have discrimination, when we did have the Tuskegee experiment. And I can tell them, I grew up in Birmingham all my life. I was seeing those grotesque pictures of those men who had syphilis and got no help, and how quite frankly, the government did use them, trying to learn things, but used them. And what we've been working to do at UMBC is to produce scientists of all races who care about people of all types. So we believe in the scientific workforce. We know that by having people from all backgrounds, women and men, Black, white, Hispanic, Asian, involved in creating these vaccines and helping with the manufacturing, everybody's involved. And so when Jackie and I went down to the University of Maryland Center for Vaccine Development, it was very gratifying to see young people of all races involved as healthcare workers helping us in this process. When everybody's involved in the process, then people trust the process. And that's what we need right now.
As a man who runs a leading research university, how impressed were you with the speed of how this has all happened?
This is breaking all records. There's no doubt. As we talked to my graduate, Dr. Corbin, and Dr. Caitlin Sattler, who's also a UMBC graduate, they're working as a lead scientist on the asymptomatic patients. What we see is that people with brain power and commitment can do anything. And what's key is they have used all of what's necessary to make sure it is safe, with Dr. Graham and Dr. Fauci working with these younger people all together to build the science for humankind. This is showing us what's possible. And what people need to understand is this is not the last time we'll go through a challenge. We've seen challenges before. We'll see more challenges, but the more we build the science and the more we educate young people to do the science and all the other work that's involved in the ethical challenges that we're facing right now, the more prepared we will be to deal with life. And so this is about our future generations.
And since you're there on campus, I do want to ask you about UMBC. Tell me how you guys are weathering it and what you're doing for students right now as you try to get through a semester.
Sure. We are so proud of our UMBC students and their families and our faculty and staff. Everyone's working really hard. Yes, many of the courses are taught remotely, and we're trying to be as sensitive to students as possible. Others are taught on campus in the hybrid kind of fashion. Others are doing research, and we've kept the positivity rates down because, quite frankly, the students have been amazing in being disciplined and understanding what they need to do, whether they're on campus or off campus, and the idea of the social distancing and washing your hands and definitely using those masks. So we believe in the science at UMBC. and we believe in humanity. So all those courses, from the sciences to the humanities, are teaching us how to live our lives in these challenging times.
You got it all covered. Dr. Freeman Hrabowski, thank you for your time this morning. We appreciate it.
Great. That's great. I'm still thinking about the fact that you're Jim Newton's son. That's amazing. That's really great.
That's what my name will say underneath, Jim and Vera's son. Thank you for the time, sir.
I love it. I love it. Thank you. Take care now.
Thank you. Bye-bye.
Okay.